Hello guys, welcome back to our YouTube channel. Today in this video we are going to learn one of the most important organon topic from exam as well as from the practice point of view, that is intermittent fevers or intermittent diseases. But before beginning with this video, do not forget to like, share and subscribe to our channel and hit the bell icon to get notified about our content. Also, this video would be slightly long because of the vastness of this topic, so please watch this video till the end. So without wasting much more time, let's begin. So at the beginning, let's understand what are intermittent diseases. So intermittent diseases are those type of diseases where some symptoms recur at certain period of time. Example, malaria, kala azar, TB, etc. The most common example which we always tend to think in the context of intermittent diseases is malaria, where the fever typically returns after a fixed period of time. Now that we have understood what are intermittent diseases, let's understand the classification and then in detail the treatment of each type of intermittent disease. So intermittent diseases are classified broadly into two types: typical intermittent diseases and alternating diseases. So at first, let's understand alternating diseases in detail. Now alternating diseases are those type of intermittent diseases where certain set of symptoms alternate with another set of symptoms at uncertain or non-fixed intervals. Let's understand this from an example. Consider a case where a patient has pain in legs as well as pain in head too. But the most important characteristic is that the pain in legs begins as the headache subsides and headache begins as the pain in leg subsides. This is a classical example of alternating diseases. In the above case example, we can see that these two set of symptoms do not appear or recur after fixed interval of time. So now that we have understood alternating diseases, the next question is how to treat them. So at first we have to see the miasmatic classification or miasmatic origin of the disease, and on the basis of it treatment can be decided. If the disease is of soric origin, then the use of constitutional or use of antisoric remedies should be made. While if the disease is of fixed miasmatic nature, then it is complicated with syphilitic or psychotic miasm. Then the use of antisyphilitic or antipsychotic remedies should be used alternatively with antisoric or constitutional remedies. Next, let's understand the typical intermittent diseases in detail. So by definition, typical intermittent diseases are those type of diseases where the symptoms of fixed nature recur at a fixed time interval when the patient is between the recurrence enjoys good health. Now in a case of malaria, fever recurs at certain interval of time and between the two episodes of fever, the patient usually remains symptom free. Now let's understand the classification of typical intermittent diseases. The classification of typical intermittent diseases firstly includes febrile typical intermittent diseases. These are those type of typical intermittent diseases where the patient has a fever as recurring symptom. The next can be afebrile typical intermittent disease, where the patient has no fever. So the treatment of afebrile typical intermittent diseases remains the same as that of alternating diseases, where the treatment would depend on the miasmatic classification of the case, where if the symptoms are of soric, then the use of antisoric should be made, while if the symptoms are complicated with other some miasm, then the use of antipsychotics and antisyphilitics should be made alternatively with antisorics. And now let's have a look at the febrile typical intermittent diseases. Now febrile typical intermittent diseases are further classified into four types of typical intermittent diseases. The first one is sporadic or epidemic intermittent fevers. The second can be endemic intermittent fever in a marshy district. The third is individual intermittent fever not residing in a marshy district. And the fourth can be epidemic intermittent fever where none are endemic. On hearing these names, it becomes difficult for us to understand the meaning of these diseases. But don't worry, we would explain each type of disease in detail. But this video would be slightly long, so do watch this till the end. So first, let's understand sporadic or epidemic intermittent fevers. These are those type of intermittent fevers which affects different group of people at different places or might affect many people or almost everyone at a single place at same time. In these intermittent fevers, each paroxysm comprises of two or even three distinct alternating states, that is heat, chill or sweat stage. The second important is the epidemic intermittent fever in the marshy district. These are those type of intermittent fevers which prevail in a particular area because of some harmful or noxious things in the surroundings and affects a person only when the person's immunity is lowered. The next is individual intermittent fever not residing in the marshy district. These are those type of intermittent fevers which affect individually in different areas and not necessarily people who have lowered immunity because of some noxious influence. The third is the fourth is the epidemic intermittent fever where none are endemic. Now these are just the normal epidemic fevers which break out and affect several people in a group in a same place having similar symptoms. So now that we have seen the different types of febrile intermittent illnesses, let's have a look at the treatment. So first, let's have a look at the treatment of sporadic or epidemic intermittent fevers. So in every treatment part, there are three important things. The first is selection of remedy, the second is the time of administration of the remedy, and the third is the repetition. So in treatment of sporadic or epidemic intermittent fevers, the remedy selected should be able to produce at least two alternating states of fever in a healthy individual and should also strongly correspond homeopathically to the most important or prominent state of the fever. And also, the best time of administration of the remedy is before the paroxysm of the intermittent fever begins, or as soon as the paroxysm of the fever is declining. And the dosage of the remedy should be a single dose, and then the response should be judged. Now, let's have a look at the treatment of the epidemic intermittent fevers in a marshy district. In these cases, the time of administration and repetition of the dose remains same as the previous time, but the terms of selection of the remedy are different. In terms of selection of remedy, there are two types of cases. The first one is where the patient or the person follows a good lifestyle living in a marshy district, where one or two highly potentized doses of China or Cinchona are enough to settle the case. While in these type of cases, or in the second type of cases where the person doesn't follow a good lifestyle, use of antisoric or constitutional remedy becomes inevitable. In these cases, the change of surroundings can also help the patient. Next, let's have a look at the treatment of individual intermittent fevers. So, according to our master Hahnemann, these diseases should be treated as general acute diseases and the remedy from the class of acute remedies should be chosen and the cure should be completed with a constitutional remedy. And in the last type of epidemic intermittent fevers, after seeing few cases of epidemics, we can see that in most of the cases same remedy pops up and cures the cases again and again. This remedy should be selected as the genus epidemicus. So this was all about intermittent fevers. We hope that this video proves useful to you all. If you like this video, do not forget to like, share and subscribe to our channel and hit the bell icon to get notified about our content.